Welcome back to my cardiovascular disease series where I'm offering new perspectives of your cardiovascular health. Today's topic, video number 2, is blood tests. This is Dr. Ellen Rencher, and if you're not familiar with me, I am a clinical nutritionist in functional medicine. I'm a chiropractor, and I began my career in cardiac rehab as an exercise physiologist. So if you haven't watched the video 1 on cholesterol, I suggest that you do because we reviewed what raises cholesterol and the causes of cardiovascular disease. Hint, it's not cholesterol. Today's topic is blood test markers to ask your doctor to add for a better evaluation of your health and cardiovascular risks. Of course, if you prefer, I can order and review your blood tests with you. In our last video, I gave you a different perspective on cholesterol and the causes of cardiovascular disease. You gained a better understanding of why cholesterol was rising and causing plaque in your arteries, which could then lead to high blood pressure, heart attacks, and possible strokes. My goal is to help you turn your health around. However, as a clinical nutritionist, I'm usually the last door the patient enters for a solution to their health issues, after trying a very long list of healthcare professionals and treatments. They're tired of all their symptoms and taking medications that are making them feel worse. And usually they've been told their blood tests are all normal. And this is why I created today's video, because when it comes to heart disease, you may not have any symptoms. It's known as the silent killer. The first symptom may be a fatal heart attack. My point being, whether you do or don't have symptoms, I'd like to encourage each of you to get these tests for a better screening of your cardiovascular health. Now, there are several people I had in mind when I put this series together, especially today's topic. The first one is a marathon runner. And during his regular annual checkups, he was told his blood pressure and cholesterol were all normal. And then one day he had a heart attack. Another 49-year-old man had elaborate blood tests done regularly due to his family genetics for cardiovascular disease. His blood tests always came back normal. When he had his heart attack, he was told he had severe blockage in 3 of his coronary arteries, one at 90%, the other 2 at 40 and 60%. He couldn't believe it. How could this be? All his previous blood tests were normal. While both of these men were told their blood tests were normal, none of the previous tests evaluated the risk of plaque or other factors that may lead to a heart attack. Both men had no symptoms. Scary. What are the better blood test markers? I'm going to give you that list right now. But also, it may be important to mention here that these normal lab values can be a fairly wide range of what's considered quote-unquote normal. In functional medicine, we use optimal health values for a healthier level of normal. The blood tests I will be giving you today are focused on the causes of high cholesterol that we discussed in the cholesterol video, plus other factors that contribute to cardiovascular disease and markers that identify high levels of the atherosclerotic cholesterol and plaque. Okay, so let's get started. I'm going to begin by listing some of the traditional blood tests your doctors may already be testing to evaluate your health. The first one being comprehensive metabolic panel. Now, we talked about the liver's role in cholesterol, so this is included in this comprehensive metabolic panel. It's also going to test your level of glucose, calcium, and other kidney markers. The cholesterol panel, of course, you know of, that's going to test your total cholesterol, your HDL, LDL, and triglycerides. The CBC, this one just looks at your red and white blood cells, hematocrit, and hemoglobin, but that's also important. And then maybe, but sometimes doctors leave this out, they should also be testing your iron, ferritin, and fibrinogen. All of these are important to include and may be contributing to your risk factors for cardiovascular disease. However, none of these will alert you to the risk of plaque and the higher risks of cardiovascular disease. So here are the important markers that I'd like you to ask your doctor to include. The first one is HSCRP, or sometimes called cardiac CRP. This is the marker that will evaluate your inflammation level. Remember, we spoke of the importance of inflammation causing your cholesterol to rise. Now, some doctors may test the basic CRP, and that is not as sensitive as the one that I'm giving you here. HS stands for highly sensitive. And wouldn't you want to catch it at the more sensitive level so that you know when cholesterol is building up in your arteries? Ask for this particular test. The next one is called hemoglobin A1C. And you may have heard of this marker when you see the diabetic commercials, but this test is for everyone because it's going to measure the average sugar level over a 3-month period of time. It's better than the glucose marker because glucose marker basically just tells me what you ate the night before. So this is an average of blood sugar flowing through your arteries on average on a daily basis. And we've learned about how sugar can irritate that inner wall of the artery, so this is an important marker. The next one is called fasting insulin. Now, I only have one asterisk in front of this particular test because if your previous tests that I'm giving you, the CRP and the hemoglobin A1C, are normal, you may not need to have this test. And your doctor may not want to add a lot of tests, so this one's not as big of a priority as the other two. But this one can evaluate whether you're becoming insulin resistant or at some other higher level of metabolic syndrome or diabetes. The next one is called homocysteine. Homocysteine is what we call an independent cardiovascular disease marker. Now, what does that mean? That means that if all the other markers that I mentioned are normal, if this one is high, you are still at risk for cardiovascular disease. And just like sugar, insulin, and the inflammatory foods that we talked about in the first video, homocysteine can damage the inner layer of your arteries. So what causes the high level of homocysteine? Homocysteine rises when there's a deficiency of vitamin B6, vitamin B12, and folate, all of which are in your egg yolks. So why are you only eating the egg whites? Eat the whole egg. It's healthier. Sorry, just drives me crazy when people think they're cutting out the yolks to be healthier when it actually eating the yolk is healthier. Okay, moving on. Vitamin D. Vitamin D, in addition to being important for immunity and bone health, regulates blood pressure because it works on the endothelial cells, that inner layer of the artery, and the smooth muscle cells. Remember, vitamin D is made from cholesterol when the skin is exposed to sunlight. So the deficiency of vitamin D has been associated with various cardiovascular risk factors and the higher mortality and incidence of cardiovascular disease. By the way, vitamin D supplements are best taken with good fats. Okay, so now we're moving on to the smaller particles of cholesterol. The smaller particles of cholesterol are more dangerous and associated with plaque. In several studies, the next test that I'll be giving you is listed as the best indicator of plaque, atherosclerosis, coronary artery plaque, and vulnerable plaque. Vulnerable plaque is when the plaque can break off and travel and become a stroke. The name of this test is ApoB over ApoA1 ratio. This is another one of those independent markers where if all your other factors are normal, if this one's high, you are still at a high risk of cardiovascular disease. This ratio has been found to be a better indicator than if you test either one of these individually. So the ApoB, that's the damaged LDL or the atherosclerotic portion of the cholesterol. And the ApoA1 is a portion of the HDL that is anti-sclerotic. So having that ratio is very important. And in several studies, they list this as the best indicator of plaque, atherosclerosis, coronary artery plaque, and vulnerable plaque. So this is a very, very important marker to get on your tests. Now, our last test that I'm going to list is called Lp(a). Now, this test is thought to be only for those people who have family genetics for cardiovascular disease, because in their bodies, they'll have a higher ratio than people that don't have that genetic component. However, studies are now showing that if you have a high level of cholesterol, whether you do or do not have the genetics for cardiovascular disease, it may be another good test to add. These little a particles are the sticky particles that your liver makes, which can be beneficial because it's there for the patchwork, but of course in high levels are going to cause more plaque. This test will show the bad cholesterol that's becoming plaque and will rise if you are a smoker, you eat a lot of trans fats, and with high stress. So there you go. That's the list. I feel that if you have these blood tests done, you'll have a great evaluation of your risks. The question then becomes, what will you do with this new information? Will you use more drugs to calm down the inflammation? Will you continue to avoid foods with cholesterol? Will you take synthetic supplements that cause more harm than good? Changing habits or mindset is always tough, but I hope you continue to follow this series to learn how you can turn your health around. If you'd like my assistance in improving your test results and lowering your risks, I'd be happy to help you. Our next and third video will cover statins, which are cholesterol-lowering medications. We'll cover the benefits, risks, and side effects. This is Dr. Ellen Rencher. Thank you for joining me today. I'd love to hear your opinion of these videos, and be sure to subscribe to my YouTube channel here so you can be notified when our next video are up for you to view.